My life before the Kryptopyrrole treatment, I was dealing with depression fairly regularly. It would be at the most frequent 10 to 12 days, at the least frequent probably once a month or 6 weeks, where I'd have depressive episodes of 2 to 3 days at a time. It was difficult to get a good rhythm going in my life because, like clockwork, every couple of weeks I'd have a depressive episode where I'd have 3 days where nothing felt worthwhile or fun, and there was, no hope, and all the depressive symptoms you know and love. I tried basically everything on the list that they tell you to try. I've been to therapy. Well, first I tried alcohol and drugs, so don't do that. That's the worst thing to do. Meditation, journaling, regular exercise, and ice baths. And, to some extent those things do work, but, I had to do all of them just to keep like a normal base, to be anywhere near a normal person. But, I just got sick of my life being interrupted by these phases of depression. I'd say if there's anything that prevented me from getting started with the Kryptopyrrole treatment, it was just the fact that it's kind of new. I had a hard time finding a lot of research on it, and I know that it is kind of new. I've spoken to my therapist about this, and I mentioned that I was doing this, and he was like, oh yeah, that's pretty new, kind of cutting edge stuff. What surprised me the most with the Kryptopyrrole treatment is the personal outcome, how well it has worked. It has been night and day. My mental health has never been like this since my whole adult life, at least. When I started experiencing depression, 16, 17 years old, it has never been this good since then. So that's kind of one interesting effect of this, is that I don't have to wake up and do my run and meditate and journal. It's a great thing that I don't have to do those things in order to get to a baseline. The short answer is I'd recommend DHA Labs because this has worked so well for me. Like I said, it's been night and day. I've recommended this to people even without severe depression like mine, people with moderate anxiety type of disorders, things that are just like these little things where, is worth just checking. It's just a blood test and a urine test, and they can just look at these 4 ratios and they say, okay, 2 of these are out of whack. For me, it was all 4, which was exciting. But it's, a couple of these are out of whack. Let's fix them with vitamin. I mean, it's vitamins. It's like, vitamin D and like primrose oil. It's like benign stuff. So I'd recommend it to anybody who feels like their mental health is the least bit negative. I think it's worth a shot for almost anybody. I feel so hopeful that this type of treatment is available to people. Like I said, I've tried everything to treat my depression, and nothing ever really finally worked. It was always something I was managing, not something that I could figure out. It felt like it was impossible to figure it out. It felt like something I was just going to live with for the rest of my life and just kind of manage like a chronic illness type of thing. And to see that it was something so simple as just a nutritional dietary supplement, it gives me a lot of hope. I just wonder how many people out there have what I was dealing with that could just be treated like that with a blood test and vitamins. I'm excited for the future. I'm excited to see where this goes, and I think this can help a lot of people. It's a beautiful thing. My name's Peter Kolter from Tampa, Florida.